everyone, my name is Mia Harris. I did my case presentation on cystic fibrosis. Cystic fibrosis is a genetic condition that affects a certain protein in the body. It is caused by a mutation of the CFTR, which is the cystic fibrosis transmembrane conductance regulator gene, and it relates to the protein that is involved in the chloride ion transport in the cell membrane. So this defects in the exocrine gland causes abnormally thick secretions such as the tenacious mucus. So the main organs that are affected by the cystic fibrosis are the lungs, pancreas, and the digestive tract. So in the lungs, the sticky mucus obstruct the passages such as the airflow in the bronchioles and the small bronchi, causing atelectasis, which can lead to permanent damage to the bronchial wall. The thick mucus provides a medium for the bacteria to grow and also therefore causing infections in the lungs, and this can add progressive damage to the lungs tissues, leading to respiratory failure and death. In the pancreas, the ducts of the exocrine glands become blocked, leading to deficit in the pancreatic digestive enzyme production as well. This can lead to malabsorption and malnutrition. Cystic fibrosis is manifested in the newborn as the meconium ileus, which means the intestine in the newborn is blocked by mucus, preventing the excretion of the meconium, which is the black stool that the babies always poop whenever they're born. So cystic fibrosis is diagnosed at birth during the newborn screening, but it can also be diagnosed shortly after, later on too, as well. All right, patient history. So we'll get into the case study. Patient is Christopher. He's a 10-year-old boy, comes to the clinic with his parents due to complaints of chronic productive cough with shortness of breath and wheezing. The parents reports that he has also been having night sweats. He's also been lethargic and been losing weight as well. They also report that Christopher has always been a sick baby. He developed a cough shortly after birth, which has been persistent throughout his life, with frequent respiratory infections and poor weight gain. Christopher was seen in the ER. He did a test for TB and that was negative. So we're going to get into this other symptoms that he presents with. Other symptoms include chronic cough, which is due to accumulation of mucus in the respiratory tract, and this is associated with cystic fibrosis. Wheezing is caused by the thick mucus that clogs and narrows the bronchioles and the bronchi, making it difficult for air to pass through. So this is also associated with the cystic fibrosis. Fatigue is caused by poor nutritional intake, which can lead to decreased strength and fatigue. Muscle and joint pain. So with cystic fibrosis, there's chronic inflammation, which leads to pain and discomfort throughout the body, including joint and muscle pain as well. Abdominal pain and diarrhea. So the gastrointestinal obstruction with mucus can lead to GI issues such as abdominal pain, constipation, or diarrhea. So these are all consistent with cystic fibrosis. Jaundice also was noted as well. So obstructive jaundice is caused by the thick mucus that blocks the bile ducts of the gallbladder. So cystic fibrosis can lead to liver damage as well, which impairs the liver's ability to process bilirubin, leading to jaundice. Physical exams findings. So on physical exam findings for this patient, there was abnormal growth. So with cystic fibrosis, there was the weight and height were below the 5th percentile. So with cystic fibrosis, it impairs the growth and the body weight due to the malabsorption and poor nutritional intake. There was increased respiratory rate and decreased breath sounds. So hyperventilation can occur to compensate for the difficulty breathing and hypoxia. And the decreased breath sound is also due to the sticky mucus in the airway. So these are all consistent with cystic fibrosis. Clubbing of the fingers. Clubbing of the fingers can occur also due to poor respirations, leading to complications such as chronic hypoxia, which can trigger changes in the tissues of the fingers and nails. Sinusitis, which is inflammation or infection of the sinus. This can be due to the thick mucus formation, which blocks the drainage of the sinus, causing the infection. So bronchiectasis. This is abnormal widening and thickening of the bronchial tubes due to repeated infections. So this patient has had respiratory issue for most of his life, almost all of his life, and he's had repeated infections as well. So this will be a common presentation in his symptoms. Diagnosis testing that can be done, well, let's say that was done for this patient. Sputum culture. So the sputum culture was positive for Staphylococcus aureus, and this is the main cause of the cystic fibrosis. It can be caused by this bacteria. Excuse me. So also the sweat test was also done as well, and the sweat test was it shows increased chloride concentration of 90 millimole per liter. So the normal is 40 to 60. So with cystic fibrosis, there is the abnormal function of the CFTR protein. So therefore, there's higher concentration of the chloride in the sweat. So the CFTR protein does not function properly, of course, with cystic fibrosis, to regulate the chloride ions across the cell membrane. So this is why there's higher concentration of the chloride ions in the sweat, and this is one of the diagnostic testing for cystic fibrosis. Chest X-ray and CT scan show hyperinflation, bronchial thickening, and bronchiectasis. So these are all testing that are done that are consistent with cystic fibrosis and evidence of mucus plugging in the lungs. Also pulmonary test. So pulmonary test was done and it showed obstructive pattern with decreased FEV1 and FVC ratio of 50. So the normal is 70. So this test is done to measure the airflow in the lungs, and it is done by deep inhalation and forceful exhalation. So the FEV1 is forced expiratory volume. It measures the ability to expel air from the lungs by breathing forcefully into the spirometer. This is a machine that measures the amount of air that is expelled from the lungs in 1 second. The FCV is the forced vital capacity, and it measures the amount of air that can forcefully be expelled after deep inhalation and exhalation with maximum effort. This is also done by breathing into the spirometer, and it will measure the amount of air expelled. So the stool elastase test was also done. The stool elastase test was 90, which is decreased inconsistency. The normal level is above 200. So this is due to pancreatic enzyme insufficiency. So the sticky mucus obstructs the pancreatic ducts, preventing the digestive enzyme to be released, including the elastase. So these enzymes are responsible for the breakdown and absorption of fats and fat-soluble vitamins. So with cystic fibrosis, you will have decrease of the pancreatic enzymes, and this is what happens. So based on all of this, we can say that the patient has a confirmed diagnosis of cystic fibrosis because he does have all the symptoms as I explained already. So he would have been diagnosed with this at birth because this is usually diagnosed at birth during the newborn screenings, and like I said, he did present with all the symptoms. I'm going to go through this quickly now. How this can be treated. So this can be treated with intravenous antibiotic to cure the staph infection. And then next, the intensive chest physiotherapy can be done to help loosen and remove the thick mucus from the lungs and chest cavity. So this includes the postural drainage, percussion, and coughing technique. So the patient will sit on the bed, lean forward, and the healthcare provider will do a percussion on the patient's back, and then help them, and then while they're coughing at the same time to help expel the mucus out of their lungs. Pancreatic enzyme replacement therapy. One of the common enzyme replacement therapy is the pancrelipase or the cortisone. Can be given to the patient as well. Biosalts can also be given to the patient with meals and snacks to improve digestion and absorption, which will also help to promote general health and resistance to infections. A well-balanced diet is also good as well. A well-balanced diet of high protein, low fat, and vitamin supplements can also be given to help with cystic fibrosis. Also, it's good to avoid dehydration, which can result from excessive sweating or stool. So any kind of fluid deficit will result in thicker respiratory mucus. And also the use of bronchodilator and humidifier can also help as well to promote drainage by dilating the bronchioles and loosening the mucus from the lungs. All right, so that is the end of my presentation, and thanks for listening. These are my references. Okay, thank you.